The global pandemic accelerated the demand and development of remote healthcare services, which is how the entire medical system realized the benefits of telemedicine. Think about it. All these sick people, yet it was advised to stay at home in quarantine. The healthcare industry had experienced massive changes over the last decade, and COVID was the straw that broke the camel's back by increasing the risk and workload from our essential workers. So today, we are here to talk about the top 3 reasons why healthcare providers across the globe should implement and optimize telehealth services while being backed with effective EMR integration tools. Number 1. Cost reduction for patients and providers. Industry research has shown a direct correlation between patient care provided via telehealth services and an overall reduction in cost to both patients and providers. Patients have gotten substantial cost savings related to standard clinical visits and high-priced emergency room visits, with an average of $121 net saving per remote visit, and travel time up to $3 million annual across the entire United States. Now, for providers, they also experience reduced costs by preemptively monitoring high-risk patients and reducing hospital readmissions, reducing the number of in-person staffs, and taking advantage of telehealth reimbursements. For hospitals, in particular, a reduction of just 1% in emergency department visits has a potential to save over $100 million per year, enough to fix the camel's back. Number 2, faster care from anywhere. Initially, the biggest impact by far was felt by patients living in rural areas, with nearly 25% of adults saying distances from medical facilities are a major pain in their lives. Now fast forward a few years, and telehealth services are improving patients' access in urban areas as well. These users can address basic medical issues, request prescriptions, and attain specialist referrals without ever having to see a doctor in person. Number 3. Mitigation of infectious diseases. We all remember the year that the earth stood still during the pandemic. The healthcare industry, however, was the biggest exception. Doctors, nurses, emergency responders, and all other hands were on the move. They were constantly understaffed and severely overworked. Not surprisingly, this was an opportunity for telemedicine to truly shine. Programs like Virtual First Responders gave medical staff the ability to consult with patients in emergency situations and help them far faster than any visit to the emergency room. All of this with the added benefit of a significant decrease in exposure of all parties to a globally spreading disease. So how does electronic medical records integration fit into all of this? To provide these highly beneficial services, providers need to leverage new technology that will allow them to streamline workflows, create treatment plans, track progress, and securely store and exchange private medical information. This is where EMRs come into play. These records constitute everything that would appear on a traditional paper chart, including medical history, prescriptions, diagnosis, and everything else. When it comes to adopting and optimizing a provider's telehealth delivery model, EMR integration with other digital applications is critical. Without strong EMR systems, these services have the potential to create more problems than they even solve. For example, in remote care, a bidirectional interface is used to communicate between EMRs and the telehealth software. This allows the two platforms to instantaneously send and receive data so that they are not isolated from each other, while also increasing efficiency in decision-making, creating faster diagnostics, reducing errors in prescribing medications, streamlining workflows to see more patients per day, and increase overall revenue from the organization, among other things. By now, you could probably see the major benefits of an integrated EMR system. And luckily for us, there are solutions out there such as Intely to make this process easier. A healthcare interoperability platform that simplifies the integration of healthcare systems and data exchange. Make your workflow easy with Intely. Drag, drop, done. Anyways, folks, thank you all for tuning in, and I hope you found this video helpful. Please leave us a like and subscribe if you would like to see more of this type of content in the future. Thank you.